Welcome, everyone, and thank you for joining our presentation today, introducing our new system for communication and professionalism online training. I'm Bruce Wortman, Manager of Educational Development and Manager of Healthcare Communication and Professional Formation Programs. I'm also one of the managing editors at Drexel University College of Medicine. And joining me today is my associate and also managing editor, Barbara Lewis. This presentation, as we just announced, it's being recorded. Okay, now I'm not advancing to my slide here.
So you can, okay.
There we go. Yep, it clicked. I'd like to give a preview. I think that jumped one slide too quickly. Nope, we're good. I think it's important to offer a little background about who we are and how these modules were developed. In 2003, our own professor and associate dean of clinical skills, Dr. Dennis Novak, a leader at the Academy of Communication in Healthcare, teamed up with Drs. William Clark and Ron Sazal and partnered with Dr. Christoph Datweiler to create the first communication skills modules. These modules were funded by a generous grant from the Arthur Vining Davis Foundation. In 2005, it was awarded the grant, and it launched as a pilot in 2005, and it debuted in 2006 as a nonprofit. We continued to develop additional modules, and in 2013, Drexel College of Medicine received another grant from the Arthur Vining Davis Foundation to develop a new program to address the needs of professionalism training in clinical practice. In 2017, professional formation launched as a trial with a grant from the Macy Foundation, and in 2020, due to the COVID years, we offered professional formation for free to provide the breadth of our modules to any institution that could use them. In 2021, the Macy Foundation awarded us a grant to develop a brand new module on anti-racism, which I will share with you in just a few minutes. And in 2023, the anti-racism module was released, as well as we launched the revised platform that we're now sharing with you today in presenting our healthcare communication and our professional formation modules. So healthcare communication, formerly known as DocComm, it now has 44 modules with over 700 videos. These modules demonstrate the skills and techniques of communication in clinical practice. Professional formation offers 15 modules demonstrating and assessing essential skills in professionalism. All of our modules used in medical, nursing, PA, and residency programs. Both programs feature a breadth of educational topics. Soon you'll see the range of healthcare communication modules, but they're organized in 5 categories: basic elements, essential elements, advanced elements, communicating in specific situations, and communicating with colleagues. And in professional formation, we present just a few selected titles here in this list, but I can show you the full range of the module titles in just a few minutes. There's 15 in total, including 1 on faculty development. Our modules are used in healthcare education, including residencies, medical programs, nursing, PA. All of our modules employ evidence-based techniques. There are 10 journal articles that provide the value of our modules, and I can show you where you can find more information about those when we get into our information site. Modules can be used as instructor-led or self-paced, flipped classroom. There's a lot of different ways how the modules can be implemented within your curriculum. And our modules have been used in over 20 countries and translated into 3 languages. These are just a sampling of the journals that have researched and provide the value of our modules. And yep, that jumped, sorry. And I'm going to jump right over to our site so I can demonstrate There we go. A little slow today. There we are. So on our homepage, you'll find that there are a range of free modules. We have 7 that we provide at no cost, just they're free access. There's also information on our 2 programs, Healthcare Communication and Professional Formation. I'm going to show you an example of a typical module. This is our newest, Anti-Racism in Healthcare, and it's quite extensive. Most modules aren't as extensive as this. Most modules will take about 1 hour to complete. This is quite extensive, and we've broken it down into different sections. And we also provide a handy healthcare communication curriculum guide. You can download this Word file for your use, and you might find it quite useful in helping to integrate this module into your curriculum plan. To give you a sense of the depth of the information here, I'm going to show you an example of the kinds of videos. And the videos in all of our modules are unscripted. These are clinicians, practitioners, students, residents that are featured in here, and they're giving us real-world situations. In the Anti-Racism module, most sections have an interview between our Associate Dean of Diversity, Equity, and Inclusion, and he's interviewing one of our graduates who describes some of his experiences as a person of color in his clinical years. And these are very insightful in how maybe unintended or possibly intended aggressions have been, he has experienced, and how he has dealt with them. So they're quite educational. Further down, we have videos that demonstrate how these kinds of aggressions can occur in clinical settings, how a physician recognizes that he's made an error and what he intends to do about it, and how the intern has felt and maybe feels minimized. And then the team is expressing their concern and their support of their team member and what they might do to help minimize future aggressions. There's also discussion questions. All professional formation modules have discussion questions, and these open up dialogues between the facilitator and the learner. When they are assigned, there's a text box within the discussion question for the learner to enter their response. The facilitator can read and also reply to those responses. Another interesting set of videos and content in this module are the Anti-Racism in Action videos. And these explain an occurrence between a provider and an interaction with the team, and how the team was offended and supported their team member in helping to mitigate that offense. So all of these are freely available, and you may use these within your organization. I'm going to show you some of the benefits of both healthcare communication and professional formation modules. So one thing that we get asked often is, well, what are the benefits of these modules? How can they help us, help our learners, help our residents? And some of the benefits of our skills modules are that some of the skills can help reduce the incidence of patient satisfaction or negative patient satisfaction scores. So our modules can increase the higher outcomes in clinical encounters, increase the higher patient satisfaction survey scores, greater patient understanding of their treatment plans, reduce patient distress, among many other positive outcomes. And all of these, of course, can lead to decreased lawsuits due to a miscommunication or misunderstandings between clinicians and patients. Our website offers a lot of information that we won't get into great detail today, but I want to make everyone aware that We have an extensive list of testimonials from our medical schools who are subscribers, our residency programs, physician assistant programs, physicians, and students who use our modules. Additionally, we have a broad range of articles that have cited healthcare communication, formerly.com modules, but they are the same modules, as well as all of our published research and links to those, and they're cited, that have revealed the value of our training modules. In professional formation, we provide similar information. Again, the need for professionalism, a full list of all of our titles. I'll show you those within the actual product, and additional testimonials from our trial users when professional formation was in trial for 3 years. We also have a depth of resources. So within our resources, we have all of our webinar presentation archives. Clicking on a title will actually present the webinar archive directly in this pane. And we also have an archive of all of our podcasts, as well as professional formation has similar resources. We have some of those webinars, and there's also podcast resources there. We also have the free modules contained within both programs, personal growth and professional formation, and any racism in healthcare is available within professional formation section, and healthcare communication. All of our free modules are located here. Subscription information is available on both sides, healthcare communication and professional formation. Subscription data is important if you are planning on integrating these modules into your program. It's good to know that we greatly discount the group subscription for any institution. So typically, individual subscriptions are $195 for healthcare communication, $225 for both programs, or $70 for just professional formation. And we reduce those costs to only $30 a user, $40 for both programs, or $20 just for professional formation. And I'm going to switch over now to the actual login site. So logging in, every user is identified by their name and their institution affiliation. We provide all of 44 healthcare communication modules within our sections, basic modules, essential elements. So clicking the title expands that list of modules. Clicking on any title or any image opens that module. For example, just clicking the image and you see the videos, the rationale, the learning goals, the patient's view, key principles, and then all of the content within the module with additional videos that demonstrate the practices and the skills and techniques for patient and clinician communication. Essential elements, advanced elements, such as responding to strong emotions, sadness, anger, and fear, nonverbal communications, promoting adherence to healthy behavior, shared decision-making, just to name a few titles. We have communicating in specific situations, like the family interview, pediatric encounters, adolescents, geriatric patients, tobacco intervention, also clinical assessment of substance use disorders and medicated assisted treatment, and managing chronic pain, as well as unexplained symptoms, delivering bad news, dialogues about unwanted and tragic outcomes. And then our last title, communicating with colleagues, and a range of modules from oral presentation to high performance teams, giving effective feedback, effective clinical teaching, and boundary issues. So that's a quick overview of the range of modules within healthcare communication. Tapping the Professional Formation tab opens up all the modules available in Professional Formation, Personal Growth and Professional Formation, Bioethics and Foundations of Professionalism, Hidden Curriculum, Healthcare Professionals' Role in Regulating Peers and the Profession, Social Justice, Beyond Recovery and Learning from the Wake of an Error, Interprofessional Teamwork, Boundary Issues, Moral Distress, Compassion and Resilience, Confidentiality, Creating Organizational Cultures that Foster Professionalism, Remediation, Healthcare, Anti-Racism in Healthcare, and our module on Faculty Development. So that's the breadth of modules. Opening any module will reveal, we have pre-post tests. Pre-post tests are self-assessments. The learner will read the questions and assess their feelings, beliefs, or understandings based on the question or the proposition presented in that pre-test. And they just self-assess, they self-rate. They give themselves just a general position on whether they understand completely or not at all, the question being presented. When they submit that, that is then saved as their pre-test position. The learner can see that within their results score. They learn from the module, they complete the rest of the module content, and then they are assigned to complete the post-test, which are the same questions, except now that they've learned from the module, their attitudes, beliefs, understandings, hopefully, will be different. And then they can rate themselves again. And once they submit that, they can see the pin positions of where they have started to now where their understandings have changed. And that is then recorded, and the facilitator can see those results based on their growth. Assessments include multiple choice tests. So questions provide 3 to 4 answers per question. The learner can just randomly choose their answer, eventually finalize their test, and those scores are also recorded in the facilitation tab. I won't save those answers. So our system provides tools to manage not only your users, but assign users to groups, and also have the ability to assign them any of the modules. So just a quick overview of what the administration tab looks like. You can add or change the access levels of any of your learners within your group. Assign learners to groups just by creating a new group and adding users within that group. And creating groups would be essential if you're going to actually use our LMS to send and retrieve results from assignments. Facilitation tab is quite useful when assignments have been given and the results are available. All of the assignments and results are available for the facilitator's dashboard. For example, in healthcare communication, clicking the review icon will give the facilitator the palette for showing how well learners have completed their multiple choice tests. Seeing the results, clicking the question will show the question, the correct answer, and the rationale for each answer. Red letters indicate that that answer was marked wrong. There is the score for each learner and the average group score for that test. With professional formation, additional data is available. For example, not only the multiple choice tests, but also discussion questions. And here is where the facilitator can interact with the learner in group format. The learners, other team members can also reply to those questions and the student responses. So a facilitator would enter a response here and then submit that to the student who posted the comment. The facilitator can also respond to the other participants in the group and reply to those as well. Checking the multiple choice questions, you see the responses for each member in the group who have completed the quiz. Same here, you see the question, the correct answer, and the rationale. With pre-post tests are kept anonymous. We believe that students will be more honest with themselves if their identity is unknown to the facilitator. However, the individual score is for pre and post test is recorded. The percent change per question, and the question is revealed here just by clicking the question 1, 2, or 3. And you have the group average score as well as the percent change per question for the entire group, as well as individual student scores and percent changes. Learners have a separate palette for their own individual results. So even though you can see all of the group results, learners have access to only their results in their own palette for their results. And when assignments are given, we have an assignment link directly to a module that allows the learner to read the instructions by the facilitator, who is assigned, the name of the group, and the assigned activities. There's a due date. All those are defined within the facilitation creation palette. Links to the actual assessment are easily available at the top, and learners would just complete the test, and any other instructions that might be accompanying that particular assignment, whether it's pre-post or multiple choice tests, discussion questions, the links to those assignments would appear here. So, Barbara, do we have any questions so far?
No, Bruce, nothing is in the chat, but if you'd like to ask a question, please go ahead. Oh, well, we do have somebody with a raised hand. So Amit, do you want to unmute yourself and
Yes,
ask?
thank you. Hi, good morning. Can you hear me?
Yes,
Yeah.
absolutely.
Great. Thank you so much for providing us this information on this webinar. So I'm here with some of my colleagues. We're at the TCU, Texas Christian University's Burnett School of Medicine in Fort Worth, Texas.
Great, welcome.
And so I'm a part of our group that focuses on the curriculum development for exactly this, for communication skills for our medical students, and our assistant dean is on the call here, Dr. Erin Nelson. So Erin and I were wondering, it sounds like you have a lot of great content, both basic and specific, for students, for other learners. My question specifically is about sustainment and maintenance of skills. So how are students evaluated, months after or a year after they've taken some of these courses or gone through some of these videos and tests? I'm curious about, are the faculty that work with them trained? Are they trained to observe for these specific behaviors? Is there some type of marker for how well they're keeping up these skills as they progress along? Because as when you go through all your different rotations, you kind of start to imitate the people that are around you. So if they're not using the skills, do they feel alone in some of these skills, and do they dwindle? I'm just curious about the sustainment.
Well, I think that's a great question. I think a way to assess their progress would be, let's say we pick a module, maybe it's about communication skills in maybe essential elements, and maybe gathering that information. That might be a good module to discuss right now. So if the module was offered, let's say this year, let's say, you're going to offer it in this particular rotation, and your students are assigned to review the content of the module, take the MCQ, answer, let's say, first 2 or 3 discussion questions. Okay, so they complete that assignment. Now, maybe 6 months later, or maybe the following year, offer them the same assignment. So they're not going to see their previous answers. They're not going to have that same discussion question. They'll have access to the answer. However, if they're going to now respond differently from the same module content, they've had a year's experience maybe doing some of their clinical work. They have matured and developed a better understanding of patient and clinician interaction. So testing them again, asking them the same questions, and now comparing their answers from this year as opposed to their 2025 answers. In professional formation, it's a little bit more comprehensive in that you have the pre, post, you have discussion questions, and you also have questions for reflection. Those questions for reflection, they're available in both programs, healthcare communication and professional formation. The questions for reflection are really between facilitator and the learner independently. The group is not seeing those questions for reflection responses. So seeing the maturity and the development of those responses over, let's say, a course of a year would be very telling to you to see how well the program is working for them and how well they're progressing in their communication skills.
Got it. Thanks for explaining. And I forgot, I was remiss. We have another member of our team here too, Heather. So, hi, Heather. Sorry about that.
So Bruce, I just wanted to mention a couple of other things as well.
Sure. Mhm.
So we have the studies that have been done. We have 10 studies, and some of those studies did look at the sustainability. I will talk just for a moment about an experience that I had where someone came up to me at a conference that we were at and said that they loved the communication modules. And what they had done is they had sent out a survey to their students asking if what the students thought of the modules. And because it's a flipped classroom style, where you study outside and then you usually come in for small discussions and watch a video and dissect it and reflect on it. The students had said no, they didn't like to have the outside work. So they dropped the communication modules, they unsubscribed, and she said our board scores plummeted as a result. So they immediately the next year re-upped and resubscribed. And so I think that sort of goes to your point, Amit, where the longevity or the sustainability is it's not just what you're learning in the classroom or in the small group discussion, but you're applying on your boards as well. Lori has her hand up as well. Lori?
Hi, Lori.
Hi there. Hi, Bruce. It's nice to see you over Zoom like this. So actually, Dr. Singh's
Oh, right.
question.
Yes, I recognize.
Yes.
How are you?
Nice to see you. So Dr. Singh's question, I'm Lori Callan. I'm from the New York Institute of Technology, College of Osteopathic Medicine. And Dr. Singh's question just spurred something for me. When it comes to the subscription, I saw in the group it's up to 500 users for that certain price. Now, let's look at clerkship. So we want to send a pre-clerkship module to our pediatric students. Would we be able to also have certain program directors or residents or chiefs who are assigned to our students also be able to log on and watch the modules, so that just not the preclinical year faculty are able to see, but even your clinical faculty who may not be, they're affiliated with the school because there are clinical faculty at various sites, but it does get a little difficult sometimes to manage the various people who are going to be coaching and teaching the students on rotation. So my question is more about the subscription. Would it be something that, all the NYIT students would have access to it, plus those program directors or residents who are going to be teaching our students along the way? That might be able to help us track progress, year to year if everyone's speaking the same language, which I think might be what Dr. Singh is talking about. It's hard when the students have more knowledge than their preceptors. So I thought I'd ask that. My second question while I'm here, when the student is running a module and they're doing an MCQ, if they get the wrong answer, do they also have the ability to see the right answer and see the rationale themselves? Or is that only something that the facilitator gets? Thank you. Those are my two questions.
Okay, sure. So we'll do the first one first. So yes, anyone who is affiliated with your institution, any subscribing institution chooses who they want to enroll in their account. So if it's your faculty, if it's your coordinators, if it's attendings. You can enroll them and you can unenroll them. Maybe certain people only need 6 months access, and then you can rotate that access off and on when you choose to, or you just give them full access all the time. So if you have clinicians who are doing rotations with your students, yes, they absolutely can participate in your account and they can have full access. They can be also facilitators for that group, so they not only can recommend certain readings or videos or entire modules to examine, but they can also assign something and also see the results. Our advice is to have more than one facilitator per group because, back on, home turf, you're going to want to see, well, how are my clinical groups doing? I want to take a peek in there. You would have access to do that if you're a facilitator in that group. So your second question, I'm sorry, I just blanked. Remind me again.
It was about if the student is able to see the correct
Yes.
answers and the rationales while they're taking the quizzes.
Yes, so the learner can see when they complete an MCQ. There's two ways of doing, any of these modules. If they are assigned through our system, then you, the facilitator, as well as the learner, can see those results as soon as they are submitted. As soon as they hit that finalize and submit button, you see the result, they can see the result. Learners' results are inside the My Results tab, and they will see their score for that assigned module. And they can click on the question link at the top, see the question, because they're not going to remember what each question. They'll be able to see the answer choices. They'll see the correct answer, and they'll know whether they answered the correct answer or not. And they'll be able to read the rationale, but after they have submitted. Okay. If they only completed independent learning, they can see their result, but you won't because it wasn't assigned to them. All modules are free, open access to anyone in your account who wants to learn independently. But if they complete any of the assessment tasks outside of an assignment, they're free to do so. They'll be the only ones who see those results.
That's actually really helpful so that they don't feel any punishment or fear of dabbling around and trying out things.
Well, exactly. And we designed these modules to be formative, not as the final end all, here's the scope of your abilities or, your understandings. They're meant to be formative. And that's also why when the modules are assigned, that same module, just sort of going back to Amit's question and how I answered it, is that same module can be reassigned again to reevaluate their progress. So because it was facilitated, it was assigned through our system, and therefore you now have a record, with a time span in between, and you can compare those results because the facilitation dashboard retains all that information.
Oops, thank you so much. Those are great.
You're very welcome. I know we're just beginning to run out of time. Are there any other questions I can answer?
No, nothing in the chat either. Thank you, Bruce.
Thank you very much.
I put in the chat the link to the site and also the fact that the anti-racism module is free.
Well, thank you, everyone. If you have, was there someone speaking up? Maybe not. Okay. If anyone has any additional questions or comments, please, you may reach out to myself or to Barbara. My email address is here, or both of our email addresses, as well as the link to our information site. That's web link was also available in our invitation. You're free to visit us anytime, call, email. We're happy to give you a more in-depth presentation if you would like to talk further about how we can help you. Thank you, everyone. I appreciate your attendance, and we're always here to help. Thanks very much.
Thank you.
You're welcome.
Thank you, Bruce. Everyone looks as though they're leaving. Oh, hi.
How are you?
I'm good. I'm sorry I joined late. My last clinic patient took longer. I don't know what I missed, but the conversation at the end was interesting. And thank you for sending me the link to sign up. I haven't yet done it, and I was wondering if you have a few minutes now, or we can set up a meeting to see how I can go about making others members.
Yes, give me one. Let me just double check my calendar. I'm pretty sure I'm okay. I am. All right. I just have a call later this afternoon. I just want to quickly take a peek at my calendar for a second. Sure. Happy to help. Barbara, are we still
Thank
recording
you.
or are we done?